What is or what are the differences between loop diuretics, thiazide diuretics, and potassium-sparing diuretics? In this video sponsored by Alphameg Nurse Tutors, we are going to be breaking down the differences as much as possible. And so, I want you to follow along as we demystify these diuretics. Let's get right into it. The first one we're going to be talking about is the loop diuretics. Now, before we talk about these different diuretics, especially starting with loop, the question we need to ask is, what exactly are diuretics? Well, diuretics are medications that their mechanism of action is to cause an individual to urinate as much as possible, depending on how much effect they have. That's just it. These are medications that cause individuals to want to urinate, to want to void, to form urine. And so, the first one we are talking about is loop diuretics. What is loop diuretics? Where do they act? And what do they do? Now, loop diuretics acts on the kidneys. Specifically, they act on the thick ascending limb of the loop of Henle. Yes, you heard that right. As you can see in the image. Now, this particular part of the nephron, which are, the millions of microstructures that is responsible for forming urine in the kidneys, this particular structure here, when urine is forming, or during the formation of urine, that part is responsible for reabsorbing sodium and reabsorbing water. But now, here's the thing. Loop diuretics goes to that thick ascending limb and obstructs the reabsorption of sodium. I want you to always remember this. Wherever there is sodium, you will always see water. Yes. And so when you obstruct the reabsorption of sodium, it means that you are going to be wasting sodium, and for that reason, loads of water will equally leave the human body. But here's the thing about loop diuretics. Sodium is not just the only ion that is going to be lost. Potassium is going to be lost, and in large quantity. Yes, which will lead to what we call hypokalemia. That is low serum potassium level, of course. And so, when you think about it, loop diuretic doesn't spare potassium at all. Potassium, sodium, as well as chloride ion are all lost. Examples of, the loop diuretics that we have is the likes of furosemide and butanamide. Yeah. And so that is one thing, or the mechanism of action for loop diuretics. Let's talk about thiazide diuretics. Now, when it comes to thiazide diuretics, these thiazide diuretics act on what we call the distal convoluted tubes of that same nephron. Yes. Now, this is the part whereby any form of fluid that is lost at this point is gone. Anything that gets past this part is gone. And so, as you can see in the image, that is the part the thiazide diuretics act on. Now, they inhibit the reabsorption of sodium as well as the chloride ion. Equally, when it comes to this thiazide diuretics, it's not as potent. It's not as, it's not as potent as the loop diuretic. Loop diuretics has the highest, while thiazide diuretics has a moderate effect when it comes to causing an individual to urinate. And equally, in this case, too, potassium is equally lost. It could equally lead to hypokalemia. Very, very important. Some examples of these thiazide diuretics are the likes of clothalidone and hydrochlorothiazide. Yeah. So these are examples. Now you see the difference. Loop diuretics acts on the thick ascending limb of Henle, while the thiazide diuretics act on the distal convoluted tube. Yes. Now let's talk about potassium-sparing diuretics. Now, from the name potassium-sparing, it means that they're sparing the lives of potassium. You get the idea? Now that's what we're talking about. And so let's see, where does the potassium-sparing diuretics act? Potassium-sparing diuretics, they act on the collecting ducts and the late distal tube. Yeah, that is where they act. Now, what do? they inhibit or they antagonize aldosterone or block sodium channels. That's what they do. And potassium sparing diuretics, its effect, it's actually low, but the advantage there is that depending on the individual, there are some individuals that have low potassium. Yeah, serum potassium level. Now, when it comes to this, you have to consider that you don't just give any form of diuretic like the loop or the thiazide. You have to give potassium-sparing diuretics as prescribed. Emphasis: as prescribed by the doctor. Don't do what we did not ask you to do. But you see, whatever it is that you would spare, there's a chance that there is a side effect. And the potential side effect for using potassium-sparing diuretics is what we call hyperkalemia. That is increased serum potassium level. Now, the likes or the examples of such diuretics, that is potassium sparing, we have the likes of spironolactone and amiloride. Yes, spironolactone and amiloride. Yeah, you see, when it comes to pharmacology, sometimes the pronunciation can be quite difficult. But if you take your time, you see that it's pronounced as spironolactone and amiloride. And so there you have it. These are the differences. Always remember that the differences between these three are where they act the kidneys, specifically the nephrons. Specifically for loop diuretics, it acts on the ascending limb of Henle, the thick ascending limb of Henle. For the thiazide diuretics, it acts on the distal convoluted tubes, and for the potassium sparing, it acts at the collecting duct, and equally the late part or the latter part of the distal convoluted tubes. Very important. And equally, always know that the most potent of this one that is very aggressive of these diuretics is the loop diuretics. There's significant loss of fluid as well as significant loss of sodium, potassium, and chloride. And when it comes to thiazide diuretics, there is a moderate loss of fluid as well as loss of sodium and chloride ion. And then when it comes to the potassium sparing diuretics, potassium is spared. It could lead to hyperkalemia, and sodium is not spared, as well as aldosterone is blocked. So yes, so there you have it. These are the differences between loop diuretics, potassium sparing diuretics, and thiazide diuretics. If you enjoyed this video, share with your friends. Save this video for the future because you might need it. And equally, if you need classes or you would love to book one-on-one classes with us at Alphameg Tutors, so that you have a grounded knowledge of whatever course or topic you find difficult, why don't we discuss and book a class with us? See you on the next one.